Hey, Art. Welcome to another episode of the New Resilience podcast.
It's exciting.
Yeah. Thank you for having me. Thank you for having us and being on the show. So, again, as you might know, the in this show, what we try to do is bring folks like you who've been in the industry for a while over and like get an understanding about your experience and talk specifically about like challenges and lessons that people can learn based on that. So that's what we are about. So I guess let's just dive right in.
Sounds good.
Yeah. So Art, maybe again, you've had a fairly long career in the field already. So maybe it'd be great if you could sort of like talk through how you got started in the field. What were some of your inspirations, or sort of what drove you to the field?
hmm Yeah, I've thought about that over a period of time. So I formally entered the field in about 1988. So
Mm,
I'll date myself a little
okay.
bit. Um, I think I was introduced to the field just through family experiences, community experiences. Growing up actually in this community, not too far from Clark's Manor
Yeah.
in Delaware County. Um, I was thinking back, I think my first real experience in the helping world, the social work type of world was in elementary school. I served as a safety as a sixth grader with our kindergartners. And our
Mm.
responsibility was to just be a mentor and keep kids safe on the playground, getting in and out of their kindergarten classroom.
It's a regular kindergarten. Okay.
Yeah, so it was a really fascinating way of getting introduced to just looking out for others.
Nice.
Yeah, and and grew up in a family with teachers, social workers, and a great uncle who also worked in the recovery field,
Mm.
as did an aunt at some point. So it was just started to come naturally, and went through my own trials and tribulations as a adolescent, and through that experience and personal experience was introduced to the recovery world, um, which back in the 80s it was kind of nice to get an opportunity to give back in so many ways. Um, I was able to do my first, college placement and internship at 6 months clean and sober.
Mm.
And in today's world, you probably need a little more time, but it just worked out nicely. Um, and was able to, just translate that into meeting some wonderful people, finding something that just felt natural
Mm.
to learn about the clinical, the social skills, um, the family components, and with that, the struggles that come along with it.
Mm.
But there's, as I think back too, there's no doubt that having family and friends who were accepting and understood um, certainly gave me a leg up on folks that don't always have it so great.
Yeah. Yeah. Okay. So that's a fascinating. Thank you for like sharing the journey out. So one question that I had was, what do you think, like today and like looking into the future a little bit, what are some of the biggest challenges that you see in the field?
I mean, for everybody involved, whether it's the professional, whether it's the family member, the person seeking care themselves, is accessing the right services, the right care, in a sustainable way.
Mm-hmm.
So, you know, I've seen that in the public sector, in the private sector, in mental health, substance use, even and definitely in the medical world too.
Right.
And we're trying to bring all of that together on a regular basis. There's, and identifying experts, uh, identifying the right resources, and connecting them as soon as possible. Because I think efficiency matters. We have so many families we work with have told us, it's been such a journey, 10, 15 more or plus years of trying something, and it's a lot of resources. And then when they finally find the right fit,
Mm-hmm.
they don't have the resources to continue,
Hmm.
or they get cut off.
So are you saying like it almost takes much longer than you would want for someone to actually get access to the right care?
Definitely saying that.
Okay.
Absolutely. I mean, that's how Clark's Manor came about.
Hmm.
I can briefly speak just
Yeah.
on,
Yeah. That'd be.
we have an amazing donor family that we work with, and they spent, over a decade helping their son
Wow.
identify what their real challenges were, He wanted help. He wanted to feel better, but just even identifying what was going on with him
Mm-hmm.
and what was the right setting, the right supports was trial and error.
Hmm.
And finally finding an expert that understood, made the right connection,
Right.
and began a journey of wellness. And what really stinks about that is folks, especially in mental health, there's this brain elasticity, and each episode makes it harder and harder and harder to come out of that dark hole
Oh, wow.
and
Okay.
and be well, get well, stay well.
Mm-hmm.
So we're trying to eliminate that and allow healing to start sooner
Hmm.
and it lasts longer.
Got it. Have you had any recent such challenges yourself to like, I mean, I'm sure like you get a bunch of calls today, like trying to like for families seeking care or like someone referring to you, like seeking the right place. Have you experienced any of those challenges trying to place people?
Definitely. That's
Yeah.
something that happens more often than not. Most of the phone calls, most of the emails, most of the inquiries that we get
Mm-hmm.
aren't the right fit.
Mm-hmm.
And we take a lot of pride in getting some information and helping get people to a place that sounds right because we have a resource somewhere or
Mm-hmm.
several somewhere
Yeah.
um, because they didn't know about it. They didn't know
Mm-hmm.
how to access it. And that's every week, a couple times a week.
Mm-hmm.
I had a family that was here a week and a half ago, and they said, I wish we knew about you 10 years ago. We didn't even exist 10 years
Right,
ago,
right.
but they didn't know where to go at all. So now they're starting to find things, through different communities that are coming together, but we need to bring these communities together more and more so folks can access the right care.
Got it. And so, and what are these communities like? Are they comprised of treatment centers? Do they have like other behavioral health sort of providers in there, or like how
The
does?
great question is we don't always know because
Okay.
there's different approaches to bringing resources and partners together.
Mm-hmm.
Some of them are publicly funded. Some of them are through, city government. I worked
Mm-hmm.
in Philadelphia for a while, and they're doing the best they can to have their
Mm-hmm.
providers in a network and helping as a gatekeeper for referral sources, loved ones, and people themselves to identify what's going on and get to the right place.
Yeah.
Then they have to navigate everything that goes with that.
Mm-hmm.
Are the hours of operation even appropriate for them? Do they have the physical resources to get there? Do they have the insurance to cover it?
Yeah.
And then, and even dealing with stigma and the like along the way of,
Yeah.
how do I get to a treatment place or a recovery option without being outed as somebody who needs
Yeah. Yeah.
help?
Yeah. And like the longer you sort of spend trying to find someone, I think the greater the chances are, in some sense of, you know,
Yeah, people are going to get frustrated. They're
yeah.
going to, whether it's mental health, how much tolerance does somebody have
Mm-hmm.
to barriers?
Mm-hmm.
And we need to break those barriers
Yeah.
down. And that's what community needs to do.
Right. And so when we talk about like what the ideal sort of setup would be for like is it about the scale of the community in itself where like you're talking about maybe a few silos that exist where and again there might be some places or providers who might not even exist on like these given communities. So is it about bringing them together?
Mm-hmm.
Do you think that's a big factor of it?
It's a huge factor that we
Yeah.
don't know about each other.
Right.
We, over the past year, joined a trade organization that we were accepted into the American Residential Treatment Association. Fabulous, important.
Mm-hmm.
A lot of folks don't even know about it.
Mm.
Yet these are organizations that have been around for a long time, provide high quality services, and people don't know how to access them.
Mm.
And that's one small community, us providers.
Right.
And then what about payers? There's insurance companies.
Mm-hmm.
I think they're challenged with the idea of who's in network,
Mm.
even keeping their own networks up to date.
Mm.
I've personally experienced going to find a provider in network, whether, for medical even or other, testing resources,
Yeah.
only to find out you're on their website is in network and you call the place like, well, we haven't been in network with them for 2 years.
Oh, wow.
So imagine that somebody that now has anxiety, depression, or other thought disorders trying to navigate that block.
Hmm. Wow. So you're talking about like not only bringing the data together, but like bringing the communities together, but having really high quality, up to date data on them.
Absolutely. We've relied heavily on having great relationships at different places,
Hmm.
but sometimes people move on.
Right.
So now I don't even have if I don't have a relationship with the entire organization or have a platform where we're going to be recognized and can access whoever's even covering while somebody's out.
Yeah. Yeah.
I mean, imagine that if somebody calls for Clark's Manor,
Yeah.
we got to make sure we have a team available.
Right.
As because if I'm on a vacation,
Yeah.
what's somebody supposed to do? So even those barriers need to be broken down.
Got it. And then, so when you're thinking about like, let's look at it, like if you're part of a community, maybe let's look at it from two angles, right? So one is like we talked about like the overall, like the data being present and like the silos being broken. But if we go deeper, let's start out from from the situation where let's say you, maybe this happens a lot. I think you already preluded to the fact that this happens a lot, where a lot of the calls that you get you're not able to take them at Clark's Manor. But you still want to make sure that person goes to the right place,
Mm-hmm.
which could be due to insurance reasons, payment, the type of care, etc. How would you like ideally, in an ideal scenario, how would you like to make that judgment if, let's say, a community were to be available to you? How do you decide on, say, placing someone?
To me, ideally, if there was a platform or a community where I could just direct them and say, hey, get on this community, here's a portal address, and plug in your information,
Mm-hmm.
or talk to somebody and as a central repository, as a
Mm-hmm.
sense, they're going to be able to connect you with the top three resources in real time.
Mm-hmm.
I'm doing the best I can, as are many of our colleagues, that if
Yeah.
you call me, it's not the right fit, I'm still going to try and get some information to say, let's try this or this.
Yeah.
But that's not a uh,
Yeah.
that's limited to my knowledge. That's
Yeah.
limited to my peers' knowledge.
Right.
It
Right.
helps, and there's great legacy knowledge out there that needs to get plugged into these
Also, like, are you
communities.
saying this knowledge does not exist in like publicly, but it's more so in a lot of people's heads, for lack?
Without question,
Okay.
sure. Um, yeah, in the ARTA community, for example, we have an ability to share anonymous information to say, hey, what would you do? We're trying to find placement or support for this
Mm-hmm.
person based on these characteristics. So we have a small team that can start to look at it. If it's not within the ARTA community,
Mm.
we have to, you know, essentially hope somebody has knowledge
Mm.
that goes outside those, 29 organizations.
Right.
Because there's a lot of great fits that we wouldn't otherwise find.
Yeah. Yeah.
Um,
How do you do it today? Like, do you call someone who might know a few places?
I email, I call. I got an email over the weekend, and the person, you know, simply put it, it turns out it's not necessarily a private pay,
Mm-hmm.
yet we want to help this person help their brother, which helps their mother who's trying to
Right.
take care of this. They don't know where to turn.
Right.
So I asked, here's a couple questions I have. Wouldn't it be nice if it went to that central repository of,
Yeah.
what area do you live in? What are your resources? Do you have a treating psychiatrist or therapist?
Got it.
What's your insurance or non-insurance? What's your price point?
Yeah.
There's lots of questions that we can ask.
Mm-hmm.
Um, I may
Are
have,
those the top five kind of like that you would look for?
they're in there. And,
Yeah.
diagnosis matters.
Sure.
I think we all like to understand that we have specialties and diagnosis does matter, but still take the whole person.
Yeah.
As a side conversation, which is an important conversation, we recognize that we know more now than we've ever known. And sometimes there's comorbidities in diagnosis.
Right.
So we don't want to limit ourselves to, it's just because somebody lives with schizophrenia, they might do well in a farm setting. They might do well in a rural setting. They might
Mm-hmm.
need to be in an urban setting.
Yeah.
They might be a larger program. So you have to get to know the person as well and
Right.
what their experience has been. If they've had 3 prior treatments or 10 prior treatments, they may just need something that's not so structured, but gives them that safe haven respite where they can heal
Right.
and go at a different pace. So those probably in the next 5 questions that we
Okay.
would want to ask.
Got it. Got it. And so, like, the best thing to do would be like having like some sort of like a platform or repository where you can just simply plug in those questions and like get recommendations and sort of, you know,
Yeah, and then yes, and it would be efficient for them. It
Mm-hmm.
would be efficient for us.
Yeah.
You know, I think there's so many caring providers
Mm-hmm.
who are going to spend the time,
Yeah.
but that's not efficient when we have people here to take care of,
Yeah.
or other focuses that need to be attended to. So we're trying that goes to workforce, that goes to even burning out our workforce
Mm-hmm.
because
Yeah.
we're trying to do everything to help the
Right.
whole
Right.
many communities.
So tell me more about like how do you take the call on where to like finally send them? Like the reason why I asked this is like there's the element of information. There's also like the element of trust that we've heard about where, like you again, to the same point that you're talking about, where you want to make sure that they get to the right place. Um, Traditionally we've heard cases where like you want to only refer to places where you've personally been or like a member of your team has been so that there is enough information or trust out there to so that you can send it there. um is that still going to be a factor when you're looking for information that's furnished, and does the source of the information sort of matter? Because again, we've heard of cases where like some places might, not everyone's a bad actor, but there's simply got some cases where someone could say, "Hey, I'll actually treat this," but if you go in there and turns out that they don't, that could be a negative experience for everyone involved. How?
Yeah, anytime we can have a personal experience, so it's not sight unseen, makes a huge difference.
Sure.
I mean, I would want if somebody's asking me where would you send your loved one
Yeah.
or whoever it might be, I want to be able to know I've been there. I understand why it might be a good fit from what you're explaining. So it definitely helps to have, you still have to have that personal connection
Mm-hmm.
somehow, or a trusted resource is just going to say, well, you may not have been there, but I have. And let me tell you what's good or not so good about a place.
Mm.
And, or at least ask these questions.
Mm.
I still prefer to have it with my own experience, but
100%.
it's just not feasible all the time.
Yeah.
So in that community, I know through whether it's through ARTA or through other communities, I can call somebody or they've given a review somewhere, and that matters a lot.
Right.
You know.
So being able to like reach back out to like the person who maybe like gave the review,
Mm-hmm.
to get a much more realistic sense of someone who might have spent time there or has some. I think like I like the idea of the phrasing that you did of you want to only send someone to a place where you would send your loved one. So like that's the level of sort of attention to detail
Mm-hmm.
that you want to make sure.
And the feedback also from people who've been there.
Right.
You know, over the last year, there was a organization that opened up a site not too far from our area, within travel distance,
Mm-hmm.
and I've got a chance to go there and get introduced to the team and the grounds, and it was magnificent.
Mm-hmm.
And the experience was wonderful for me.
Mm-hmm.
So I was able to say, if it mirrors that at all for the resident, wow.
Mm-hmm.
So I was able to talk to some families that it wasn't right to come to Clark's Manor at the time,
Mm-hmm.
and I suggested this place. And I had 3 different families go, and I asked each of them, what was your take on that
Yeah.
experience? And
And
each
people share that.
and all 3 of them gave me feedback. All 3 of them gave me very favorable feedback. But there's been other times I've asked people, what their experience has been somewhere else.
Hmm.
And more often than not, people will tell you negative stuff as well as positive stuff. But that helps in building that.
Yeah.
So imagine if they also had a place in this
Yeah.
world
Yeah.
where they could give a rating, give a feedback, give an experience,
Yeah.
because their experience matters.
Yeah. Like so that there is, yeah, the agency problem sort of like goes away where it's only the people who own that place are sort of talking about it. So you have a much broader sense of like where it might be.
Mm-hmm.
Let's maybe look at it from the other side as well. So like just from a business standpoint, like something that we've heard where, as again, at the end of the day, you're trying to treat people, but also run the business. So like a big part of core mental health treatment is referral relations. So do you sort of see that maybe having a community like this would also give you access to like the right people or the right referrals in some sense?
That's an important goal.
Yeah.
And and if, understanding that the conversation is the answer is yes.
Yeah.
To be able to have an efficient access point, getting feedback. Even I was working with a family and a referral source over the last 2 weeks, and I asked for an update
Hmm.
to the referral source, and I get an out of office.
Hmm.
If this was open to their whole team, I would probably get feedback faster. So now, because it's a holiday weekend, things like
Right.
that, that's 3 or 4 days that somebody's still in limbo,
Right.
and they don't have to be.
Right. Right.
I'm not sure if I'm fully answering your.
Yeah, I think it goes in that direction. And like, I think one challenge, for example, like that we have heard often on like when you're trying to get referrals is that it's, you often do not have a diversified set of sources where, let's say, you have like these 4 or 5 places where, you know, you might be getting referrals from, and that's kind of it. And if, say, one of those referral sources sort of like leaves or like
Mhm.
retires or whatever, then your sort of, yeah, set of people sort of dries up. So the idea was that could the community or the platform actually help you get the right people based on like what you treat, like your level of care and the payment.
I'm following you.
Yeah.
Yeah, we need to expand our footprint. And to do that right now, it takes a lot of time and resources and planning, such as getting to a conference,
Yep.
maybe in Chicago or San Diego,
Yeah.
and that's might be in the next 6 months.
Yeah.
We want to reach people sooner, and they want to reach us sooner,
Yeah.
in real time. And we're not able to do that very efficiently without such a community.
Right. Right. So being able to essentially do that in real time, so reduce the time to connection, and especially for cases where this would actually be a good fit. So it starts out from in a patient-centric manner where, again,
Mm-hmm.
like treatment center A or someone is actually contacting you because they think you are a good fit for patient XYZ, not because you just happen to meet at a conference and you happen to make a connection, then happen to find out that, they
Yeah,
have someone 6 months down the line that they could refer you.
that sums it up quite well.
Yeah.
And even if we meet somebody, it takes a while to do the follow up, foster the relationship,
Right.
get them to know the facility a little bit. If they could check in that community, and there's usually some linkage
Mm-hmm.
across the country
Right.
that we know each other a little bit,
Mm-hmm.
it's going to speed things up for everybody.
Yeah. Okay. So then let's go deeper into that. So when you're looking at the folks that, say, are the primary ones who are referring to Clark's Manor, what kind of places are those typically? And then, because that kind of like brings me to like the other question was like from you, what would make it useful for you to be on the community? Is it going to be different, more treatment centers? Is it interventionists, consultants? So
Mhm.
maybe talk a little bit about that.
Again, in a perfect world, a community is accessible to all of those folks.
Sure.
Treatment centers and their teams, their discharge planners, social workers, definitely the consultants, the therapeutic consultants, education consultants, and interventionists,
Mm-hmm.
and and family members for sure. I
Hmm.
mean, they spend a lot of time, and sometimes they don't want to spend the money or the time with a extra party, whether it's an interventionist. Doesn't mean they shouldn't, but
Yeah.
they're feeling a squeeze for resources.
Yeah.
They can access services
So the
faster.
faster they can get to like the right place for
Mm-hmm.
their loved one.
Yeah, and it's actually going to make better use of the interventionist time, the consultant's time.
Mm-hmm.
They're going to be focused on the right fit at the right time. And who ultimately benefits? The client.
Right. Okay. And so, like, are you in some sense saying like it is in the best interest of pretty much everyone involved in here, whether it's consultants, interventionists, or like, again, residential treatment centers, all to be in the network so that the access to care is sort of like a lot more efficient as a process?
That's what I'm saying.
Yeah.
Yeah, and don't even forget some of the insurers.
Yeah.
You know, there's people get quote unquote stuck on a unit. I've been a hospital social worker and you're
Mm-hmm.
trying to place somebody. If you don't know about everybody, if you
Mm-hmm.
don't have a community and it's just based on we used to use a Rolodex,
Mm-hmm.
or we would contact the insurer and say, who's in your network? Again, it was those same things.
Yeah.
How long would it take to get through to somebody? How long would it take to get a provider list? And then you still have to go through the provider list. If
Mm-hmm.
you could enter everything into this community, you're
Mm-hmm.
likely to get 3, 4, 5 potential fits.
Mm-hmm.
Wow. What a game changer.
Got it. And
And then that person doesn't use up resources just waiting for placement.
right, right. And that, again, that especially if it's like a hospital, that also frees up resources for like someone else to come in. So
Mm-hmm.
sort of like benefits, because again, that's something that we've heard where like hospitals are constantly trying to like make sure people get to their like like there's a huge influx of people who are coming in, so the social workers trying to like scrambling, trying to find the right place.
Mm-hmm.
And in that sense too, if they can find the right place sooner, then it's better for the social worker, the patient who's going out, and someone who is trying to like take their place as well.
Exactly. Yeah.
Got it.
Yeah. I've lived through that in the hospital world too. And there
Hmm.
would be people sitting in a crisis center. The crisis was so back they had to go to the emergency room. Now
Hmm.
the emergency room's backed up, which might slow down other emergencies. Anyway, the process just gets backlogged.
Right,
And
right.
then people won't seek care because they're just tired of being frustrated.
What happens in these cases then? Like, do people just stay on, or like are they forced to sort of
Sometimes nothing real good happens in
right,
those cases.
right,
We've had people regress because they're too much
right.
acuity and they're not in the right setting.
Yeah.
Um, and they're ready for a change.
Mm-hmm.
So there's cycles of readiness.
Mm-hmm.
Families get frustrated. If somebody has a setback or some sort of relapse in symptoms, they're going
Mm-hmm.
to be less likely to seek care because their last experience was so negative or so drawn out.
Hmm.
So it really does impact what's often called a broken system.
Got it. Um, then let's talk about maybe switching gears a little bit. Talk about the process of sending the referral as well. That's something that we've also heard has its own challenges. Where I think one is the piece that we already talked about, where you're trying to find which is the right place. So what you mentioned was, hey, like me being able to put the word out there, and then the system being able to tell you which are the right places, perhaps going through trusted sources to then finalize the right source. Then there is the other piece that we've heard about where you kind of have a place in mind, but then there is um, medical records, documents, other collateral that needs to be sent. And if you're trying to do this for like three places, that is more time spent in just, again, faxing documents and like emailing people, etc.
Mm-hmm.
Is that something that you come across?
We had an experience in the last 2 months working with a rather prominent hospital in another state
Okay.
and requested records. And besides the fact that it had to then have the power of attorney be notified for that person who's inpatient
Yeah.
to sign the document, get the signed document to their medical records,
Mm-hmm.
get the medical records to acknowledge that.
Mm-hmm.
We waited another 2.5 weeks. They actually sent us a disc. And we don't
Like
have
a compact.
a compact disc
Wow.
with the records on it. We don't have
Did you have?
anymore.
Yeah,
We don't have
yeah.
a
I don't
reader
have a
here.
flare today, so like,
Nobody. So talk about like an extreme challenge. On a regular basis, it's getting a fax that hopefully it comes through clearly.
hmm
And if it does, how many pages is it? 125, 165
yeah,
pages. Some of it's repetitive notes.
yep,
Um, so in a perfect world, I've seen demos and, I've worked with New
yeah,
Resilience and, as an example where taking those documents in a HIPAA compliant manner, getting some keywords to be scanned and getting a summary
mm-hmm.
is so helpful in
Right,
terms of saying, are there rule ins or rule outs?
mm-hmm.
So that we can be efficient, or if they're not ready for this level of care, what are they ready for?
Mm-hmm.
And just helping that process along so much more efficiently.
Yeah.
Um,
And then if you, let's say, find out that, through the assessment that you do, that this is probably not a right fit, but there's someone that I can send it to, is it helpful to, again, send over whatever assessments that you have done already to the other person so that the receiving party is not repeating the process of like going through a compact disc and
yeah,
going through those pages all over again?
it's definitely helpful. So having, again, a HIPAA compliant way to do that,
Yeah,
it helps everybody.
right.
Because ultimately, you know, you think big picture,
Yeah,
if we do it for you, you'll do it for us,
right.
and who wins? The
The
client.
the patient does.
Yep.
Yeah,
And so does the treating community.
right.
They have a community member is going to be a right fit that
Yeah,
makes it a better experience for everybody there.
yeah. Because at the end of the day, you're also creating new connections, which is
Mhm.
what is essential for you to like keep running this business, keep growing the business in some sense.
Yeah, the human element is always going to be necessary. I mean,
Right.
this is human services.
Yeah.
We're helping people, not making widgets.
Yeah.
Um, so there's this, but that combination, so we can be efficient with it, and then we do an interview, then we can have a conversation.
Right.
But to schedule an interview, get somebody's hopes up, and then find out there was this elephant in the room that's just not a right fit, we could
Right.
have gotten through that, 3 days ago.
Right. So that short circuits the process for the patient, but also, again, I think you talked about burnout and
Mm-hmm.
the time spent by your staff as well, like trying to reduce that.
Well, and sure, and there's a realistic side that there's still a business side of
Mm-hmm.
providing services. So we need to be able to get the right fit. We need to be able to, match up schedules. So we need to know, are we going to get somebody that's, kind of a loss of words, but essentially it's not just filling a bed, it's filling a bed correctly.
Mm.
That's going to be efficient for staff. Because if we have a certain mission and we have a certain approach to care,
Mm-hmm.
and we bring in somebody that wasn't quite the right fit,
Mm.
it's not the end of the world, but still it affects everybody in terms of care planning. It affects the milieu,
Yeah.
and we can continuously do a better job with that if we have the right tools.
Right. Okay. Yeah, that makes a lot of sense. Um, is there any other aspect that you would look for being part of a community like this? Is it the number of people who are in there, or um, the kind of providers that are in there to like make it more valuable for you?
Well, sure, I think filtering through. I mean, for example, for our services, we're connecting people here for behavioral health, but we're also connecting them with providers for our primary care, for dental, for
Mm-hmm.
vision,
Mm.
and even in the big picture, finding employment opportunities, volunteering opportunities. So
Interesting.
who's to say down the line we can't find organizations that are friendly towards our populations in
Hmm.
different areas? Or if
Right.
we're making a referral and somebody's leaving Clark's Manor and going to a new community somewhere else,
Right.
we can already do a little bit of mapping out with these user-friendly opportunities. I mean, in my wish list, that
Yeah.
would be pretty cool to know that. I'll give a quick example. We had a gentleman living with us going back to school.
Mm-hmm.
So there's enough challenges when somebody's already had some traumas or
Mm-hmm.
some anxieties and then needs extra help. But
Hmm.
not every organization and every school knows how to do that.
Hmm.
So if somebody was able to tell us ahead of time, this school is probably a better fit locally than that school,
Mm-hmm.
a person's going to have a better experience most likely.
Right.
So we could do that ahead of time.
Yeah.
Right now, I'm picking up the phone, we're calling, we're doing research, we're
Right.
going online, which is necessary.
Right.
But imagine how much more efficient we could be.
Faster, more efficient it would be. So it's not just like the point at which you're receiving the call, but also when you're
Mm-hmm.
discharging
Yep.
and like the transition point happens. So then being able to sort of plan that.
No doubt. I mean,
No.
it's the whole
Yeah.
continuity of care
Right.
and
Right.
support.
And it could end up in like outpatient or school or like even job opportunities.
Mm-hmm.
I had never thought about that. It's like that's pretty fascinating.
Yeah, it could really open up that world,
Right.
And if we're welcoming somebody, it's also on it. Here's some of the providers we already work with.
Yeah.
It allows people to do a check-in on that
Yeah.
stuff.
Okay. Got it. No, this is great. I think we've covered a lot of points on like the access to care, the community side. Um, are you seeing certain trends in like the recent market that are either facilitating a shift towards having to have a model like this? Maybe it's about the mobility of the people that you're talking about, or maybe regulation that's forcing treatment centers to like find more like diverse connections.
Well, this is what came to mind when you brought that up is the importance of analytics and outcomes.
Mm.
And having a community where we can have some measurables. We all have our ways of doing it, but some sort of shared measurables that are going to be comparable. It's going to open up the door towards other payer sources. It might diversify the payment,
Mm-hmm.
but it takes the burden off of families in some cases. And it also lets potential payers take a look at the most efficient places that they can connect with. You know, like right now, we're purely private pay,
Mm-hmm.
and we're still in that startup phase.
Mm-hmm.
So if we're able to say, based on our connection with our partners who have these outcomes and we have these outcomes,
Mm-hmm.
we're able to show improved uh, uh, outcomes,
Yeah, yeah, yeah.
but we're able to,
Yeah.
an example would be, somebody goes through this continuity of care, even though you've invested X amount in a private pay facility, in a psychiatrist,
Mm-hmm.
they didn't use high-end inpatient. They didn't need ambulance services. They didn't
Mm-hmm.
stress the crisis response services, let alone the impact. It's immeasurable on their families
Mm-hmm.
because they're not worried as much. They're not missing days at work,
Mm-hmm.
so they're more productive themselves. It just goes on and on and on. It's endless what we could really begin to track because we're able to provide the right care, the right direction, and not have it go all over the place and with these relapses and setbacks.
Yeah. And then this is something that you would expect that if you're part of like the community in some sense, that people in good faith would actually release these data, these outcomes for them so that they get paired with the right people.
Yes. I mean,
Okay.
good faith is part of it, but I think having the right platforms, you know, either you captured them or you didn't.
Right.
So those are going
Right.
to be pretty factual.
Yeah. Yeah. So like, yeah, you can't doctor the data in some sense. Like
Mm-hmm.
this is the data, and like if you are a part of the community, then it's all transparency is kind of like transparency and trust gotta go hand in hand. And that's really what we're talking about.
Absolutely.
Yeah. Got it.
So I think that promotes all of that.
Right.
And it's going to make everybody better because if I see somebody, that they do something really, really well, I'm going to want to watch them and
Yeah.
learn from them and get to know them a little
Yeah.
bit. Um, Same, if we're doing something really well, I would hope that others are going to want to partner with us.
Yeah. Yeah. It's almost benchmarking in some sense with, this is where I would want to be based on like looking at places that are similar to me. So
Mm-hmm.
then maybe these are three improvement areas for me, and then here are three things that people can learn from based on like what we do well. So being able to sort of share some of that.
And it's closer to apples to apples.
Right.
Right now, every state has their own licensing and it varies in what they're measuring and
Yeah.
even accreditation standards, they can vary
Yeah.
across, all kinds of measurables. In a community where we're comparing ourselves across the board, people can more likely, make an educated decision. It's
Mm.
going to matter.
Okay. Yeah. That makes a lot of sense. Maybe let's go towards your story a little more now. So, um, what keeps you excited in the field, I guess. Let's say that.
Um, it's our residents and their
Yeah.
families.
Yeah.
I mean, there's nothing better than the simple stuff.
Right.
Trying to think of what did we do? We made a dinner a couple weeks ago,
Mm-hmm.
and one of the residents said, where did we get that from?
Mm.
And he said, it was a recipe of a certain kind.
Yeah.
And I forget what it was. Oh, that was the best sandwiches I've ever
Wow.
had. And the smile on his face was unbelievable. I mean, I learned that actually from folks up in Boston. I
Okay.
remember asking the program director up at a program in Boston, said, "How do you know when people are doing well?"
Mm.
He says, "By their smiles."
Yeah.
That's what keeps us going. Um, recently one of our staff members introduced somebody to a new outing in Philadelphia, a new event that he had never been to.
Mm.
And he said, "Can we go every week?" You know, and this is somebody that typically has trouble getting out of their room and getting
Oh,
motivated.
wow. So
Now
that's a
this is a
big
person
change.
who's out every morning. When's so and so coming? Can we do
Yeah.
this? That's just keeps us going
Hmm.
left and right, up and down.
Very nice.
Hmm.
Um, and then if you have someone sort of like who's sort of young, starting to like think about getting into this field, what sort of advice would you have for them?
Mm. Um, well, I mean, in my situation, with some experience, it's being in a situation where there's mission and values that make sense to you
Hmm.
and making sure that folks are living up to them.
Yeah.
I feel very lucky. I work in an organization with a strategic plan that is a living, breathing strategic plan.
Hmm.
And it's something that I connect with. And it's something that, the partnership of the Widger Family Foundation and Elwyn
Mm-hmm.
matches up so wonderfully.
Mm-hmm.
So it's finding that home, and if you're coming in and starting with how many hours am I getting, and my paycheck, I mean, God bless you, but it's you're not in the
Yeah.
right place.
Yeah. Got it. And when you talk about like the strategic approach, um, maybe can like without again maybe sharing like very specific details, like maybe talk about what are the dimensions that someone should look at when they're trying to assess.
Um, I mean, integrity matters, um, and the happiness of the people
Mm.
that you're serving, and the happiness of the people you're working with,
Right.
and the comfort level of the families.
Mm.
I'll never forget it. A family member tell us about 6 months into his loved one being here, saying, "For the first time in 10 years, I feel like I got my daughter back." I mean, it's
Yeah.
immeasurable. How do you get a payer to recognize that?
Yeah.
Immeasurable for everybody.
Right.
And it's just been upward and not perfect, but upward ever since.
Right.
That's motivating. Um, it's but also recognizing and support an organization and a team that recognize and support each other in all kinds of ways.
Mm.
Um, that's far beyond a paycheck.
Right.
It's enjoying each other, it's uplifting each other. If times are tough, it's having somebody's back.
Hmm.
Um, that shows over and over, and it can reduce the burnout syndrome.
Yeah. Yeah. Do you see the level of burnout that's it is something that's only increasing over time, or this is something that's
Yeah, unfortunately, it's not something we can ignore.
yeah.
I mean, regulations are tough. Um, there's a lot of stigma on mental health.
Mm-hmm.
In our country right now, there's other divides going on
Yeah.
that challenge people every day.
Mm-hmm.
And also recognizing, we have access to social media, things that sometimes people get engulfed in, and how do you balance that out too, that you're not caught up in talk just to be talk.
Yeah.
So we're promoting role modeling for our residents
Mm.
can actually help staff
Yeah.
as well.
Yeah. Yeah. I guess one final question would be if people are joining the industry today, like in capacities like yours, or like, and looking to have a path like yours, what should they be hopeful about?
They definitely matter.
Hmm.
You don't see it every day,
Yeah.
um, but the impact on people's lives
Hmm.
matters, on families' lives. It's real.
Yeah.
I tell people one of the reasons I like on my day off to cut my lawn
Yeah.
is I can look and say, look what I just did.
Yeah.
We don't always get to do that in the human experience
Yeah.
until we step back, but it's really happening.
Right.
And people are flourishing, they're thriving, they're
Yeah.
growing, they have hope.
Yeah.
They don't always, people remember the good things we did even years and years later.
Yeah.
So if you're waiting for a parade or a news story every time you do something good, this isn't the field for you.
Yeah.
But it's really happening.
Yeah. Okay. That's beautiful. So I'm sure like it takes patience, but you're able to see the results and the impact that your work brings.
Yep,
Yeah.
absolutely. So You
Yeah.
know, we appreciate the opportunity to talk about it,
Yeah.
get the word out to more people.
Yeah.
Um, you know, and at some point, you know, it'll pay off financially as
Yeah.
well.
Yeah. 100%. It always does.
But I can sleep at night
Yeah.
knowing, and if somebody coming in the field, they'll be able to sleep at night knowing that they did a
Yeah.
good deed every
Yeah.
day.
Yeah. No, that's beautiful. I guess in closing, is there any other message that you would want to like send out to the listeners out there?
Um, wasn't ready for that question. I mean, the message is we're here to make people's lives better.
Yeah.
Be part of that.
Yeah.
Just be a part of it.
Yeah. That works. All right.
Thank you, Prannoy.
Thank you so much.